Hi, my name is Melissa Daniels and I have strabismus. Strabismus is when your eyes are not pointing in the same direction, like this. The good news is that it's actually possible to teach your brain to use those eyes together and to get them straight. That's what I've been doing for the last 5 years through vision therapy and strabismus surgery. And it's been amazing. But the part that a lot of people wonder about is, what about the maintenance? What do you have to do to keep maintaining that progress over time, or is it permanent? And we're gonna go all into that in this video. First, I wanted to throw out the information about what I do. I have a lot of resources over at learn.strabismussolutions.com. You can get my Mastering Peripheral course, you can sign up for a Zoom call with me, or you can get a number of different downloads that are gonna help you with strabismus in a lot of different ways. So let's talk about maintenance. I personally graduated from vision therapy about a year ago. And at that point, my vision was not perfect. We called it a soft graduation. My eyes were pretty straight. I made huge improvements. My depth perception was so much better. And I just was ready to be done with that in-office part of my therapy, but I'm still working on it. So I wouldn't even call where I'm at maintenance, because I'm still trying to improve. And so I'm trying to do vision therapy, every single day, trying to do those exercises, trying to improve my visual system. But other people have actually graduated from vision therapy. And there are a lot of different results that people have, whether they maintain that progress or whether their body goes back to the way it was before. If you think about our bodies, we have these natural set points where we like to be, right? It might be your weight or your teeth. There's just, your body is comfortable in certain zones. For people with strabismus, they might feel comfortable using only one eye because they've only been using one eye since they were born. And so these are just kind of where our body naturally wants to be. Does that mean that it's not possible to lose weight or get your teeth straightened or learn to use both eyes? Definitely not. That maintenance is going to look different depending on how severe things were to start out with. Unfortunately, there is not a lot of research about this. There is some around convergence insufficiency, which is a diagnosis where basically your eyes are pointing. If I'm looking at my finger, my eyes are actually pointing a little behind my finger. So convergence insufficiency means you're not bringing your eyes in far enough. And there is some research around convergence insufficiency in vision therapy, and basically it shows that for 2 years they're able to maintain that, not for only 2 years, but they did like a long-term study where they did their vision therapy and then they tracked them for 2 years, and at the 2-year point they were all still maintaining that progress. So for like a diagnosis like convergence insufficiency, that progress is generally maintained. They don't have to revisit their eye exercises throughout life. With strabismus, it's definitely going to be a little bit different. I want to talk about mild strabismus cases and then more complex strabismus cases. When we're talking about mild forms of strabismus, that's usually going to mean that it's a strabismus that's intermittent. So the eyes are straight sometimes, and sometimes they're turned, in or out. Another would be if it came on as an adult or later in life. So normal stereo vision was developed as an infant and as a child, and then something happened later in life that made that stereo vision go away, double vision, something like that. So those are going to be more mild cases where normal vision was developed. There's just something not quite working right in the system. What I found is that people who have these more mild forms of strabismus can go through vision therapy. Sometimes it might take a year and a half, a longer time. Sometimes it might even require surgery to go with it. There's one person that I know named Amy, and she had strabismus as a little girl. It was an intermittent eye turn, and she had 2 surgeries. And then after surgery, she did I think it was 2 years of vision therapy, a year or 2 of vision therapy from ages about 5 to 8. That's when she had the surgeries and did some vision therapy, kind of going back and forth between different treatments. And at age 8, she stopped all treatment, and she's now in her 30s, and she doesn't do any sort of maintenance. She has perfect 3D vision. Her eyes are perfectly straight. She hasn't had any trouble with double vision ever. She's never done any sort of maintenance therapy, right? So for her, she did the vision therapy, probably continued doing a little bit of maintenance for maybe 6 months after she graduated, and then she was home free for the rest of her life. So that's pretty exciting for if you're a parent and you've got a little kid in vision therapy. It's like, okay, we're going to put in this work and it's going to kind of be the worst for a couple years and then we're going to be home free. Another friend had strabismus as a child again, and he ended up having doing the vision therapy as a kid, and I believe he had one surgery. Maybe this one didn't have surgery. It's hard to keep track of everybody, but his eyes are perfectly fine. No problems at all. His whole life, great depth perception, great 3D, all of those things he learned in vision therapy as a little kid, carried him throughout life. But when he was about 40, with like all the near work with computers and different things like that, and just the natural aging process, those eyes kind of, it decompensated and started getting bad again. He started getting a lot of double vision. And so he did another round of vision therapy as an adult, and again, did like the more intensive in-office vision therapy for about a year, and then a couple months of maintenance after that. And then still 10 years later, he's fine again. And so these more like, especially like the ones that do the vision therapy as a kid, usually they're fine throughout life. Maybe, a head injury or life trauma, something might happen later in life that brings some of those visual problems back, but then another bout of vision therapy and they're good to go again. And so these more mild forms of strabismus don't require that like maintenance forever. Now let's talk about more severe cases of strabismus where the brain wasn't using those eyes together ever, right? This is like me. I was born with strabismus and I never used my eyes together my whole life until I started vision therapy when I was 32. And then we started working on getting my eyes to work together. And so this was completely new for my brain, a whole new way of viewing the world. And so this is, first of all, it took me a lot longer in my vision therapy process, and it's going to require more maintenance going forward. And that's pretty true. I've seen that pretty consistently across different people that have similar cases to mine. Sue Berry is a great example of this. She wrote the book, Fixing My Gaze. It's fabulous if you haven't read it, but she did about a year of in-office vision therapy, and then she did her maintenance exercises for, I can't remember how long, and then she decided to stop for 6 months just as an experiment to see what would happen, to see if she would lose the stereo vision that she had gained. And what she found is that after 6 months, she could still use her eyes together. She wasn't having like horrible symptoms or double vision or anything like that, but all of her levels had gone down. So her brain was slowly going back to that set point of only using the one eye at a time or not getting the full amount of stereo vision. And so after 6 months, she decided, okay, I definitely am decreasing. I'm not seeing as well. And so she just decided that she was always going to do 5 to 10 minutes of vision therapy exercises every day. And when I first heard this, I just felt this like pit in my stomach, because I was like, she graduated from vision therapy 17 years ago, and she's still doing 5 minutes of vision therapy every day. And I thought, this is never going to end. I'm going to have to do this forever in order to keep my brain using my eyes together, because my brain just always is going to want to go back to the way things were. And that was a tough pill to swallow at first. But now that I'm more in that zone, I'm realizing it just becomes a way of life, right? Like, you just pick up the Brock string, you do it for 5 minutes, you're good to go. And you don't even have to do it every day. She's got like amazing, perfect stereo, and she loves it. And so she's always working towards that. You don't have to do that to be functional. Once a week is probably enough. Another person I wanted to talk about, she did vision therapy, her eyes she'd had surgeries as a little girl, never did vision therapy or anything, was always only using one of her eyes at a time, did vision therapy, got her eyes straight, got her eyes working together, got amazing 3D stereo vision, great success story. And then she graduated from vision therapy and she just was like, I'm done, I graduated, and she didn't do anything after that. And she was fine for quite a while. She just lived her life. She had great depth perception. Everything seemed wonderful until about 6 months after therapy. And all of a sudden she started getting double vision and she was freaking out. Like, oh my gosh, I'm getting double vision. What's happened? Am I going to go back to where things were? I'm going to have to go back to vision therapy and start over from the beginning. And what she did is she just pulled out her old vision therapy exercises and pulled out like the maintenance exercises they had given her from the office. And she spent about, I think she said like 30 minutes doing it. And maybe for a week, she kind of like revisited those vision therapy exercises, and then she was fine again. And so for her, she decided every week I just need to do a little bit, here and there, maybe even every other week, just to keep my brain remembering to use those eyes together. The brain is naturally going to want to go back to the old way. But the good news is that the more you use both of your eyes and you are tuned in to using your eyes together, the easier that maintenance is going to be, because every time you read using both eyes, every time you play tennis and you're using both eyes, that is just exercising that brain's ability to use those eyes together. So in some ways, it's a lot easier to maintain vision therapy progress, especially for like a more mild diagnosis, because once the brain learns to use those eyes together, every time you look at anything, that is a maintenance exercise. For the more severe cases, yeah, you might have to make more intentional decisions about doing specific exercises to just keep that really fresh in your mind. I just want to end here by saying that it's worth it. Even though I have to do the maintenance exercises, it's completely worth it. The world in 3D is amazing, and being able to drive and play the sports that I want to play and do the things that I want to do with my vision is so worth doing 5 to 10 minutes of vision therapy every couple days. So don't let it deter you, but it is kind of nice to know what you're signing up for. If you're a little kid or you're a parent of a little kid, put in the work now and you're probably going to be fine later on because you're developing the brain correctly. If you're an adult, it's totally worth it. But if that's not something you want to do, that's something to consider from the beginning. So hopefully this was helpful in you understanding how vision therapy maintenance is going to look for you, depending on what type of eye condition that you have. And if you have any questions, let me know, and I'll see you in the next video.